diagnosis of venous thromboembolism and what we're going to do with the fragment that you've been prescribed.
Okay.
So what do you know about your diagnosis?
I know I have a blood clot in my leg, but that's really it.
Okay, so you know a little bit, but not all what it's all about.
Yeah.
Okay, so venous thromboembolism, or VTE, is a complication that often occurs during pregnancy and the immediate period following, so postpartum, you're 3 days postpartum now. So during pregnancy, your blood is more likely to clot to prevent losing too much blood during labor, because there's a lot of trauma. As well, blood does not move as much during pregnancy because of the decreased mobility, and it just kind of is stagnant, doesn't move that much. So this here shows normal blood flow through the vein, where there's no obstructions and the blood just moves on a straight path. So in deep vein thrombosis, a thrombus or a blood clot kind of forms on the side, which narrows the pathway that the blood has to travel through. And then what can occur is an embolus, which is when part of the clot will break off and travel through the vein. And from there, what can occur is a pulmonary embolism, where that travels to the lungs and actually blocks off the way that the blood can get into the lungs, and this can actually be fatal. So venous thromboembolism is an umbrella term that comprises both deep vein thrombosis and pulmonary embolism. It starts with deep vein thrombosis, which can then turn into pulmonary embolism if a part of the clot breaks off and travels to the lungs. So some signs and symptoms of pulmonary embolism are shortness of breath, rapid heart rate, rapid breathing, and coughing up blood, as well as chest pain. If you do experience any of those, you want to make sure that you seek some medical attention.
Okay.
And just to make sure that you understand everything that I've gone over with you and that I've explained it well, I just want to know if you could tell me back what you understand now of your diagnosis.
Okay, so I now understand that I have a blood clot in my leg that could break off and travel to my lungs, which can potentially be fatal.
So now I'm going to be walking you through the steps of self-injecting Fragmin. What's your current understanding of Fragmin and its action?
Well, I know it's to prevent my blood clot from getting any bigger, and I think to prevent any other ones from forming.
Exactly. So the goal of this medication is actually to break down that clot that's in your leg so that it doesn't get larger, and also that it doesn't have the opportunity to travel and cause more problems. Has your doctor gone over potential side effects of the medication with you?
No, he hasn't.
Okay, so like I've just mentioned, Fragmin actually prevents blood clots from being made, which is a good thing for your leg because you have one that shouldn't really be there. But it actually is a good thing other times when you cut yourself or anything like that to stop the bleeding. So it's important that you know that while you're taking Fragmin, you have increased risk of bleeding. So some common side effects of Fragmin are bruising, nosebleeds, and pain at the injection site. Some uncommon side effects are bleeding gums, so often when you're brushing your teeth, vaginal bleeding, bleeding from the anus, bloody urine, or allergic reactions. So if you experience any of those, you want to stop taking the Fragmin immediately and call your doctor or pharmacist.
Okay, so I'll stop immediately and call my doctor or pharmacist. I do have a question. Is it safe to breastfeed while I'm on Fragmin?
Yeah, it is. Actually, Fragmin is the most commonly used anticoagulant, also referred to as a blood thinner, during pregnancy and the postpartum for the prevention and treatment of venous thromboembolism, because only small amounts have been detected in breast milk, so it has been proven safe. Do you have any other questions about Fragmin or its side effects?
Not at this time.
Great, let's get started. Fragmin is given through a subcutaneous injection, which means it is injected into the fatty tissue of either the stomach or thighs. There are multiple sites to choose from, and it is important that you change sites every injection, as the injection can cause bruising and pain. This handout shows you multiple sites where Fragmin can be injected. Fragmin comes in pre-filled syringes, so all you have to do is take it out of the packaging. Step 1, pull off paper backing completely from the blister packaging. Step 2, rotate the packaging so that the open side is facing downward, 3 to 5 centimeters above a flat surface such as a table. Step 3, in order to release the syringe from the packaging, pull the sides in the middle of the blister packaging apart to widen the blister cavity. This should cause the syringe to fall out of the blister package. Step 4, wash your hands. Step 5, cleanse the selected site for injection with an alcohol swab. Allow the site to dry for 30 to 60 seconds. Step 6, pick up the syringe by the body. Step 7, before giving yourself the Fragmin injection, it is important that you inspect the Fragmin for clarity, particulate, which is pieces floating around, discoloration, and leakage. Also, check the expiry date and ensure that the dosage is correct. Step 8. Remove the needle shield. Step 9. With your non-dominant hand, grab a fold of skin between your thumb and index finger. With your dominant hand, hold the syringe like a pencil between your thumb and middle finger. Step 10. Insert the syringe straight into the fold of skin as far as it will go. Step 11. Push the plunger using your index finger until all of the fragment has been injected. Step 12. Let go of the plunger. The needle will push back into the syringe and you will hear a click. Step 13. It is now safe to let go of the skin fold and discard of the syringe appropriately. Step 14. Press a cotton swab on the injection site for 5 to 10 seconds. Do not rub the site.
So how are you feeling about the information I just covered?
I'm a little bit overwhelmed, but I think with practice I'll be comfortable.
No, you definitely will. Now I would like you to follow the steps that I have just gone over to practice self-injection. You did great. Do you have any questions?
Not that I can think of.
Okay, I will be sending you home with this pamphlet, and it contains all the information I've just gone over with you, as well as step-by-step instructions on how to give yourself a fragment injection. If you have any questions whatsoever, please don't hesitate to call.
Thank you.